to simply be here. Breathe in deeply, filling your lungs completely, and then release that breath slowly, letting any tension dissolve. Today we're going to explore something beautifully fundamental: how hydration transforms your skin from the inside out and the outside in. Water is life. This isn't just poetic language, it's biological truth. Your body is approximately 60% water. Your skin, the largest organ of your body, is about 64% water. Every cell, every function, every process in your skin depends on adequate hydration. When your skin is well hydrated, everything works better. When it's dehydrated, everything struggles. Let's begin by understanding what we mean by skin hydration and why it matters so profoundly. Hydration refers to the water content in your skin cells. Well-hydrated skin cells are plump, full, and functioning optimally. They communicate properly with each other, turn over at the right rate, and maintain the structural integrity of your skin. Dehydrated skin cells become shriveled, sluggish, and compromised. They can't perform their jobs effectively. Here's something many people don't realize. Hydration and moisture are related but different. Hydration is water. Moisture includes both water and oils that help seal that water into your skin. Your skin needs both. You can have oily skin that's dehydrated, producing plenty of sebum but lacking water. Understanding this distinction changes everything about how you care for your skin. When your skin is properly hydrated, you'll notice it immediately in how your skin looks, feels, and behaves. Hydrated skin has a natural luminosity, a subtle glow that no highlighter can replicate. It feels soft and supple to the touch, comfortable throughout the day. It looks plump and smooth, with fine lines less visible. It heals faster from irritation or blemishes. It maintains its barrier function effectively, protecting you from environmental stressors and irritants. Dehydrated skin, in contrast, looks dull and tired. It may feel tight, especially after cleansing. It shows fine lines more prominently, even if you're young. It may be flaky or rough in texture. It's more sensitive and reactive, becoming easily irritated by products that normally wouldn't bother it. It may even produce more oil as your skin tries to compensate for the lack of water. Now let's explore hydration from two essential angles: hydrating your skin from within through what you consume, and hydrating your skin from without through the products you apply. Let's start with internal hydration. Drinking water and supporting your body's hydration from the inside. Your skin receives water from your bloodstream. When you're well hydrated internally, your blood delivers water to your skin cells effectively. When you're dehydrated, your body prioritizes vital organs over your skin. So your skin is often the first place you'll notice dehydration. How much water should you drink? The old rule of 8 glasses a day is a reasonable guideline, but it's not one size fits all. Your needs depend on your body size, activity level, climate, and diet. A better approach is to drink water consistently throughout the day and pay attention to your body's signals. Your urine color is a simple indicator. Pale yellow suggests good hydration, while dark yellow indicates you need more water. Your thirst is another signal, though by the time you feel thirsty, you're already mildly dehydrated. Don't wait for thirst. Sip water regularly. Create habits that support consistent water intake. Keep water visible and accessible. Have a glass of water when you wake up, before each meal, and before bed. Carry a water bottle with you. Set gentle reminders if needed. The goal isn't to force excessive amounts, it's to maintain steady, adequate hydration throughout the day. coffee and tea count toward your fluid intake, though caffeinated beverages have a mild diuretic effect. You don't need to avoid them, but balance them with plain water. Herbal teas are wonderful for hydration and can make drinking fluids more enjoyable if plain water feels boring. The foods you eat also contribute significantly to your hydration. Fruits and vegetables with high water content, cucumbers, watermelon, oranges, strawberries, lettuce, celery, all help hydrate you from within. A diet rich in these foods supports your skin's hydration naturally. Interestingly, foods with healthy fats also support skin hydration. Omega-3 fatty acids found in fish, nuts, and seeds help maintain your skin's lipid barrier, which is crucial for preventing water loss. So hydration isn't just about water, it's about a balanced diet that includes water-rich foods and healthy fats. Excessive alcohol consumption dehydrates your body and skin. If you drink alcohol, balance it with extra water. Excessive salt can also contribute to dehydration and inflammation. This isn't about restriction or perfection, it's about awareness and balance. Now let's talk about hydrating your skin topically, the products and practices that deliver water to your skin and help keep it there. The key to topical hydration is a two-step approach, adding water to your skin and then sealing it in so it doesn't evaporate away. This is where the concept of humectants and occlusives comes in. Humectants are ingredients that attract water. They pull moisture from the environment and from the deeper layers of your skin up to the surface. The most famous humectant is hyaluronic acid, a molecule that can hold up to 1,000 times its weight in water. Other effective humectants include glycerin, aloe vera, honey, and various botanical extracts. Products containing humectants are typically serums or lightweight gels. Apply them to slightly damp skin. This is crucial. If you apply humectants to completely dry skin, especially in a dry environment, they may actually pull moisture from deeper layers of your skin, which isn't helpful. But when applied to damp skin and then sealed with a moisturizer, they work beautifully. Here's a simple practice. After cleansing, pat your skin with a towel but leave it slightly damp. Apply your hydrating serum or toner while your skin is still moist. Then, within a minute or two, apply your moisturizer. This layering technique maximizes hydration. Occlusives are ingredients that create a barrier on your skin's surface to prevent water loss. They seal in the hydration you've just applied. Common occlusives include ingredients like petrolatum, dimethicone, shea butter, and various oils and waxes. Your moisturizer typically contains occlusives, which is why you apply it after your hydrating products. Understanding this humectant-occlusive relationship transforms your skincare routine. You're not just slapping on products, you're strategically hydrating and then sealing that hydration in. Let's discuss different ways to incorporate hydration into your routine throughout the day. In the morning, after cleansing, apply your hydrating products while your skin is still slightly damp. A hydrating toner or essence can be a lovely first step, adding a layer of water-based hydration. Follow with a serum containing hyaluronic acid or other humectants if you choose. Then apply your moisturizer to seal everything in. Throughout the day, facial mists can provide a quick hydration boost, though they're most effective if you follow them with a tiny amount of moisturizer or facial oil to seal in the mist. Misting alone, especially in dry environments, can actually increase water loss as the mist evaporates and pulls moisture from your skin with it. In the evening, your routine can include more intensive hydration. This is a good time for hydrating masks, thicker creams, or facial oils that seal in moisture overnight. Your skin is in repair mode while you sleep, and giving it plenty of hydration supports those repair processes. Welcome and breathe deeply with me. Let yourself relax completely. Today we're going to explore oil cleansing, a method that might sound counterintuitive at first, especially if you have oily skin, but that can transform your cleansing routine. The idea of washing your face with oil might seem strange. We're taught from a young age that oil causes problems, clogs pores, causes breakouts, makes skin greasy. So washing with oil sounds backwards. But there's ancient wisdom and modern science behind this method, and understanding it might change how you think about cleansing forever. Let's start with a fundamental truth. Oil dissolves oil. This is basic chemistry. Oil-based substances on your skin, sebum, sunscreen, makeup, environmental pollutants, dissolve readily in oil. They resist water-based cleansers but surrender to oil. This is why oil cleansing is so extraordinarily effective at removing stubborn buildup. Your skin produces its own oil, sebum, for very good reasons. Sebum protects, moisturizes, and maintains your skin's acid mantle. It's not your enemy. Problems arise not from having oil, but from having the wrong balance of oil, from oil mixing with dead cells and debris, or from trying to strip oil away too aggressively. When you use harsh, stripping cleansers to remove oil, your skin often responds by producing even more oil to compensate. This creates a vicious cycle. Strip the oil, skin produces more, you strip again, skin produces even more. You're fighting against your skin's natural wisdom. Oil cleansing works differently. It gently dissolves excess oil and impurities without stripping your skin's protective barrier. Your skin doesn't need to panic and overproduce oil because it hasn't been stripped bare. Over time, this can actually help normalize oil production. Now let's talk about different approaches to oil cleansing. There are two main methods: pure oil cleansing and emulsifying oil cleanser use. Both are valid, but they work differently and suit different needs. Pure oil cleansing uses single oils or oil blends without any emulsifiers or surfactants. You massage the oil into your skin, let it dissolve impurities, then remove it using a warm, damp cloth. This is the traditional method, simple, natural, and effective. Popular oils for this method include jojoba oil, which is actually a wax ester that closely mimics human sebum, grapeseed oil, lightweight and suitable for oily skin, sweet almond oil, gentle and nourishing, sunflower oil, affordable and effective, and argan oil, rich in beneficial nutrients. The process is simple. Massage a small amount of oil onto dry skin for 1-2 minutes. Let it sit briefly to dissolve everything. Then place a warm, damp washcloth over your face for 30 seconds to steam and soften, and gently wipe away the oil. Rinse the cloth and repeat until all oil is removed. This method is natural, affordable, and allows you to customize your oil choice precisely. However, it requires more time and effort, can occasionally leave some residue if not removed thoroughly, and some people find the cloth removal step inconvenient. Emulsifying oil cleansers are commercial products specifically formulated for facial cleansing. They contain oils plus emulsifiers that allow the oil to mix with water and rinse away cleanly. These are the cleansing oils and balms we discussed in the double cleansing section. With these products, you massage the oil onto dry skin, add water to emulsify, turning the oil milky, then rinse thoroughly. No cloth needed, no residue, just clean, soft skin. Emulsifying oil cleansers are more convenient, rinse away completely, and typically remove waterproof makeup and sunscreen more easily. However, they're more expensive than pure oils, may contain additional ingredients that some people prefer to avoid, and offer less customization. Both methods work beautifully. Choose based on your preferences, time availability, and skin needs. Let's address oil cleansing for different skin types, because this is where the method's versatility really shines. For oily skin, yes, oil cleansing can work wonderfully for oily skin. It seems illogical, but many people with oily skin find that oil cleansing helps balance their natural oil production better than stripping cleansers ever did. Choose lighter oils like jojoba, grapeseed, or hemp seed oil. These won't feel heavy or potentially clog pores. Or opt for an emulsifying oil cleanser, specifically labeled for oily skin. The key is thorough removal. Make sure you rinse or wipe away all the oil. Some people with oily skin prefer to follow their oil cleanse with a gentle water-based cleanser, double cleansing, to ensure no residue remains. Give your skin time to adjust. In the first week or two, your skin might produce more oil as it figures out what's happening. This is temporary. After 2 to 4 weeks, many people see their oil production normalize to healthier levels. For dry skin, oil cleansing is particularly lovely for dry skin. It cleanses without stripping away precious moisture. You can choose richer oils like olive oil, avocado oil, or argan oil that provide extra nourishment. After oil cleansing, your skin will feel clean but soft and conditioned, never tight or uncomfortable. This is exactly what dry skin needs: gentle cleansing that preserves the skin barrier. You might not even need a second cleanse. Some people with very dry skin find that oil cleansing alone is sufficient in the evening, followed by just a splash of water in the morning. For combination skin, use different oils for different areas, or choose a medium weight oil like jojoba that balances both dry and oily zones. Alternatively, use an emulsifying oil cleanser designed for combination skin. Pay attention to how different areas respond and adjust accordingly. Your T-zone might need more thorough rinsing, while your cheeks might appreciate slightly less aggressive removal. For sensitive skin, oil cleansing can be excellent for sensitive skin because it doesn't involve harsh surfactants or potential irritants. Choose gentle oils like sunflower, sweet almond, or jojoba. If using pure oil cleansing, be very gentle with the cloth removal. Don't scrub or rub harshly. If using an emulsifying cleanser, choose fragrance-free, hypoallergenic formulas. Many people with rosacea or eczema find oil cleansing more comfortable than traditional cleansers because it's so gentle and non-stripping. For acne-prone skin, this is where skepticism runs highest. But oil cleansing can actually help acne-prone skin. The key is choosing non-comedogenic oils and ensuring thorough removal. Jojoba oil is ideal for acne-prone skin. It's non-comedogenic and helps balance sebum production. Grapeseed oil is another good choice. Avoid heavy oils like coconut oil, which can clog pores for some people. Oil cleansing excels at removing sunscreen and makeup thoroughly, which is crucial for preventing clogged pores. It can also help soften and loosen existing clogs, making them easier to extract, though you should never squeeze or pick. Some people with acne find that oil cleansing reduces breakouts because their skin is truly clean without being stripped and irritated. For mature skin, oil cleansing is wonderfully gentle and nourishing for mature skin. It cleanses without disturbing the delicate skin barrier that tends to be more fragile with age. Choose nourishing oils rich in antioxidants and beneficial fatty acids: rosehip seed oil, argan oil, evening primrose oil, or marula oil. These provide gentle cleansing plus anti-aging benefits. The massage component of oil cleansing also benefits mature skin by stimulating circulation and encouraging lymphatic drainage, which can reduce puffiness and support healthy cell function. Now let's discuss technique for effective oil cleansing. Always start with dry skin. This is crucial. Oil works best when it's not diluted with water initially. Use adequate oil. Don't skimp. You need enough to create slip so you can massage without tugging your skin. Usually 1-2 teaspoons is sufficient. Massage thoroughly for at least 60 seconds. This isn't a quick swipe. Take your time. Use gentle circular motions. Feel the oil warming and thinning as it mixes with the oils on your skin. Pay attention to makeup-heavy areas. If you wear eye makeup, spend extra time gently massaging your eyelids and lash line. Oil breaks down even waterproof mascara without harsh rubbing. For pure oil cleansing, after massaging, let the oil sit on your skin for 30 to 60 seconds to fully dissolve everything. Then place a warm, not hot, damp washcloth over your face. Let it sit for 30 seconds to steam your pores gently. Gently wipe away the oil. Rinse the cloth and repeat until all oil is removed. Usually 2 to 3 wipes total. For emulsifying oil cleansers, after massaging, wet your hands and add water to your face, continuing to massage. Watch the oil turn milky as it emulsifies. Rinse thoroughly with lukewarm water. Make sure all cleanser is removed from your hairline, jawline, and neck. After oil cleansing, your skin should feel clean, soft, and comfortable. If it feels greasy, you didn't remove all the oil. Use your warm cloth again or add a gentle water base. Welcome to this soothing moment of care. Breathe gently, allowing calm to fill you. Today we discuss calming irritated or reactive skin, how to care for skin that feels easily bothered, red, or uncomfortable with the utmost gentleness and understanding. Irritated or reactive skin can feel frustrating and uncomfortable. Your skin might sting when you apply products, become red easily, feel tight or itchy, or react to things that never bothered it before. This reactivity often signals a compromised skin barrier or increased sensitivity, and it needs gentle, thoughtful care. First, understand that reactive skin is often a temporary condition that can improve, not necessarily a permanent skin type. Many factors can cause skin to become reactive: overexfoliation, harsh products, environmental stress, allergic reactions, hormonal changes, stress, or illness. Identifying and removing triggers while supporting your barrier can restore your skin's resilience. The immediate priority when your skin is irritated is to simplify drastically and remove all potential irritants. Strip your routine down to bare essentials: a very gentle cleanser, a bland moisturizer, and sunscreen. Everything else must stop temporarily. Remove all active ingredients. Stop retinoids, acids, vitamin C, and any other treatment products. These are too stimulating for irritated skin right now. You'll reintroduce them later, one at a time, once your skin has calmed. Stop all exfoliation, whether physical or chemical. Your skin cannot rebuild its protective barrier while you're removing layers. No scrubs, no acids, no exfoliating tools. Discontinue any products with fragrance, essential oils, alcohol, or other known irritants. Even natural ingredients can irritate compromised skin. Choose fragrance-free, minimal ingredient products. For cleansing, Use an extremely gentle, creamy cleanser or even just rinse with lukewarm water for a few days if cleansing seems to worsen irritation. When you do cleanse, use only your fingertips with the softest touch. Rinse thoroughly with lukewarm water, never hot, and pat dry gently. Consider oil cleansing if your skin tolerates it. Some irritated skins respond well to gentle oil-based cleansers that don't strip or foam. After cleansing, immediately apply soothing, barrier-repairing products to damp skin. The best ingredients for calming reactive skin include Centella asiatica, which reduces inflammation and supports healing, niacinamide at 2 to 5%, which strengthens barrier and reduces sensitivity, ceramides, cholesterol, and fatty acids to rebuild your barrier's structure, colloidal oatmeal, which soothes and reduces irritation, allantoin, which is calming and healing, and Meaty casicide and other calming botanical extracts. Look for products specifically formulated for sensitive or compromised skin. These typically have shorter ingredient lists with proven soothing components and no unnecessary irritants. Apply your soothing moisturizer generously. Don't skimp. Your irritated skin needs abundant hydration and barrier support. Reapply during the day if your skin feels tight or uncomfortable. Consider adding a facial oil as a final step to seal in moisture and provide extra barrier support. Oils like squalane, sunflower, or rosehip are generally well tolerated and nourishing. At night, you might apply an occlusive like petroleum jelly over your moisturizer on particularly irritated areas. This seals everything in and provides a protective barrier while your skin repairs overnight. Sun protection remains essential even for irritated skin. Choose a gentle mineral sunscreen with zinc oxide and titanium dioxide, which tend to be less irritating than chemical sunscreens. Apply it carefully over your moisturizer. Special soothing techniques. Apply cool compresses for immediate relief. Soak a soft cloth in cool water, wring out excess, and hold gently against irritated areas for 5 to 10 minutes. This reduces inflammation and provides instant comfort. Use hydrating mists throughout the day if your skin feels dry or uncomfortable. Follow immediately with moisturizer to seal in the hydration. Consider using a humidifier, especially while sleeping. Moist air helps prevent your skin from becoming further dehydrated. Avoid all potential triggers while your skin heals. Don't experiment with new products. Don't touch your face unnecessarily. Avoid very hot showers or baths. Protect your face from extreme weather, wind, cold, or intense sun. Keep everything that touches your face scrupulously clean. Use a fresh pillowcase nightly. Use a clean, soft towel each time you wash your face. Avoid makeup if possible while your skin is very irritated. If you must wear makeup, choose mineral makeup with minimal ingredients and remove it very gently in the evening. Lifestyle factors affect reactive skin significantly. Manage stress, which increases inflammation and sensitivity throughout your body. Practice calming activities, meditation, gentle yoga, deep breathing, time in nature. Sleep adequately. Your skin repairs itself during sleep, and adequate rest supports healing and reduces inflammation. Stay hydrated internally. Drink water consistently throughout the day to support your skin's healing processes. Eat anti-inflammatory foods, fatty fish, berries, leafy greens, nuts. Avoid foods you know trigger inflammation in your body. Avoid alcohol and excessive caffeine, which can increase inflammation and dehydrate your body. Identify and avoid triggers. If certain products always irritate your skin, avoid them permanently. If seasonal changes trigger reactivity, prepare by adjusting your routine preemptively. If stress causes flares, prioritize stress management. Keep a skin diary noting what products you use, what you eat, stress levels, and how your skin responds. Patterns often emerge that help you identify specific triggers. Patch test new products before applying to your entire face, even after your skin is calmed. Apply a small amount to your inner forearm or behind your ear for several days. If no reaction occurs, try it on a small area of your face before full application. Reintroduce products slowly once your skin has calmed. After several weeks of simplified care, if your skin feels comfortable and looks healthy, you can carefully reintroduce products one at a time. Wait at least a week between additions to identify any that cause problems. Be cautious about reintroducing actives. When your skin is ready, start with the lowest concentration and use just once or twice weekly initially. Many people find they can't return to their previous frequency of active use. Their skin has shown them it needs gentler treatment going forward. When to seek professional help. If your irritation is severe, painful, or persistent despite gentle care. If you develop signs of infection, increasing pain, warmth, pus, if you suspect an allergic reaction, intense itching, hives, swelling, or if your skin isn't improving after several weeks of simplified care, consult a dermatologist. Some skin conditions like rosacea, seborrheic dermatitis, or eczema cause chronic reactivity and require professional diagnosis and treatment. Remember that healing takes time. Mildly irritated skin might calm within days. More severely compromised skin can take weeks to months to fully repair. Be patient and consistent with your gentle care. As we close, embrace this truth. Reactive skin needs gentleness above all else. Simplify drastically. Support your barrier. Remove all irritants and give your skin time to heal. Your patience and tenderness will be rewarded. May your reactive skin calm and heal. May you identify and avoid your triggers. May you treat your skin with supreme gentleness. Thank you for this time together. Calm your irritated skin gently and patiently. Welcome to this gentle space of healing. Breathe slowly and deeply, finding peace within. Today we're talking about how to treat whiteheads safely, those small closed bumps that appear on your skin and sometimes feel frustrating to deal with. Whiteheads, also called closed comedones, are pores that have become clogged with oil and dead skin cells, with a thin layer of skin covering the opening. Unlike blackheads, which are open to air, whiteheads are closed, creating that characteristic white or flesh-colored bump. The safe approach to whiteheads emphasizes prevention and gentle treatment rather than aggressive extraction. Squeezing or picking at whiteheads can cause infection, inflammation, scarring, and spread bacteria to surrounding pores, creating more breakouts. Let's explore how to treat them effectively and safely. Understanding why whiteheads form helps you prevent them. Excess oil production, dead skin cell buildup, pore clogging products, hormonal fluctuations, and inadequate cleansing all contribute. Addressing these factors prevents new whiteheads while you treat existing ones. The foundation of whitehead treatment is proper cleansing. Use a gentle cleanser once daily in the evening to remove oil, dead skin cells, and debris. For whitehead-prone skin, a cleanser with salicylic acid can be beneficial. It penetrates into pores to help dissolve clogs from within. Double cleansing in the evening ensures thorough removal of everything that could clog pores. Start with an oil-based cleanser or cleansing balm to dissolve oil-based impurities. Then follow with your regular water-based cleanser. Massage your cleanser thoroughly but gently, spending extra time on whitehead-prone areas. Don't scrub harshly. Gentle, patient cleansing works better. Chemical exfoliation is key for treating whiteheads. Salicylic acid is particularly effective because it's oil-soluble and can penetrate into pores. Use a leave-on treatment with 0.52% salicylic acid 3 to 4 times weekly after cleansing. Apply to dry skin, wait a few minutes for absorption, then follow with moisturizer. AHAs like glycolic or lactic acid exfoliate the skin surface, preventing dead cell buildup. Use 5 to 8% concentration 2 to 3 times weekly. Some people use salicylic acid and AHAs on alternating nights. Retinoids increase cell turnover, preventing dead cells from clogging pores. Over-the-counter adapalene or prescription tretinoin used 3 to 4 times weekly can significantly reduce whiteheads over time. Start slowly and be patient. Retinoids take several months to show full effects. Clay masks once or twice weekly help absorb excess oil and draw impurities from pores. Apply to whitehead-prone areas, leave for 10 to 15 minutes, rinse with lukewarm water, and follow with moisturizer. Always moisturize after treatment products. Even whitehead-prone skin needs hydration. Use a lightweight, non-comedogenic moisturizer that provides hydration without clogging pores. Don't skip sun protection. Many whitehead treatments make skin more sun-sensitive, and UV protection is essential. Choose a non-comedogenic sunscreen that won't contribute to clogged pores. For individual stubborn whiteheads, spot treatments can help. Benzoyl peroxide at 2.5% kills bacteria and helps resolve whiteheads. Apply as a spot treatment before moisturizer. Hydrocolloid patches designed for whiteheads can be applied overnight. These protect the whitehead from touching, absorb any drainage if the whitehead opens, and create a healing environment. If you absolutely must extract a whitehead, and this should be rare, do so only if it has come to a clear head and seems ready to release. Cleanse your hands thoroughly. Wrap your fingers in clean tissue. Apply very gentle, even pressure on either side of the whitehead. If it doesn't release immediately with gentle pressure, stop. Forcing it causes damage. If it does release, immediately apply a spot treatment and don't touch the area again. Better yet, consider professional extraction by a licensed esthetician who has proper tools and training. Professional facials with extraction can safely clear whiteheads without the risks of home extraction. Never use comedone extractors or other tools at home without training. These can easily cause scarring if used incorrectly. Don't pick, squeeze, or pop whiteheads that aren't ready. This spreads bacteria, causes inflammation, damages skin, and often makes the whitehead worse. Keep your hands away from your face. Don't use harsh physical scrubs, hoping to scrub away whiteheads. The particles are too large to enter pores, and harsh scrubbing irritates skin without helping whiteheads. Don't over-exfoliate thinking more will work faster. Excessive exfoliation damages your barrier and can actually worsen whitehead formation. Moderate, consistent exfoliation works better than aggressive treatment. Prevention strategies reduce new whitehead formation. Choose non-comedogenic products, skincare, sunscreen, and makeup. Heavy, pore-clogging ingredients contribute to whiteheads. Remove makeup and sunscreen thoroughly every evening. Sleeping in makeup is a recipe for clogged pores. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Don't touch your face unnecessarily throughout the day. Your hands transfer oil and bacteria that can clog pores. Manage oil production through lifestyle factors. Stress increases oil production, so practice stress reduction techniques. Adequate sleep supports skin's natural regulatory processes. Balanced diet and hydration support overall skin health. Some people find that dairy or high glycemic foods worsen their whiteheads. If you suspect a dietary connection, try eliminating these foods for a month and observe results. Be patient with treatment. Whiteheads don't disappear overnight. With consistent proper care, you should see improvement over 6 to 8 weeks. Existing whiteheads gradually resolve and fewer new ones form. Track your progress. Take photos monthly to see improvements that might not be obvious day to day. Adjust your approach if needed. If after 8 to 12 weeks of consistent care you're not seeing improvement, you may need to adjust products, add a treatment, or consult a dermatologist. When to seek professional help? If whiteheads are severe or persistent despite proper home care, if they're causing scarring, or if they're significantly affecting your confidence or quality of life, consult a dermatologist. Prescription treatments, stronger retinoids, specific antibiotics, or other medications may be necessary. For very stubborn or large whiteheads, a dermatologist can provide in-office extraction or cortisone injections that resolve them quickly and safely. Remember that some people are simply more prone to whiteheads due to genetics, skin type, or hormonal factors. This doesn't mean you're doing something wrong. It means your skin needs consistent preventive care and patience. As we close, embrace safe whitehead treatment, gentle chemical exfoliation, proper cleansing, appropriate products, and hands-off approach. With consistency and patience, your whiteheads will improve. May your whiteheads resolve safely and completely. May you resist the urge to pick. May your skin clear with gentle, patient care. Thank you for this time together. Treat your whiteheads safely and gently. Welcome and breathe deeply. Today we discussed preventing acne by keeping habits clean. Simple hygiene practices that significantly reduce breakouts through consistency and awareness. Clean habits are fundamental to acne prevention. While acne has multiple causes, hormones, genetics, stress, poor hygiene can worsen it, and excellent hygiene can help prevent it. These habits are simple, cost nothing, and make a real difference. Let's explore each clean habit that supports clear skin. First, face touching. Your hands touch countless surfaces throughout the day: doorknobs, keyboards, phones, money, accumulating oil, bacteria, and dirt. Every time you touch your face, you transfer these to your skin where they can clog pores and cause breakouts. Become conscious of how often you touch your face. Most people do it unconsciously dozens of times per day, resting your chin on your hand, rubbing your eyes, picking at blemishes. Set an intention to keep your hands away from your face unless you're cleansing or applying products with clean hands. If you must touch your face, wash your hands first with soap and water. This simple act prevents transferring bacteria and oil. Pillowcases require special attention. You press your face against your pillowcase for 6 to 8 hours nightly. Throughout the week, it accumulates oil from your skin and hair, dead skin cells, product residue, dust, and bacteria. Sleeping on a dirty pillowcase reintroduces all of this to your skin night after night. Change your pillowcase at least twice weekly. If you're very acne prone, change it every night or flip it to the clean side and change daily. This simple habit can dramatically reduce breakouts. Choose soft, breathable fabrics. Silk or satin pillowcases are ideal. They're gentle on skin, don't absorb as much oil as cotton, and cause less friction. If silk is too expensive, soft cotton works fine as long as you change it frequently. Keep several pillowcases on hand so you always have clean ones available. Make changing your pillowcase part of your routine. Towels also matter. Your face towel accumulates bacteria with each use. Using a damp, bacteria-laden towel on freshly cleansed skin reintroduces problems. Use a clean towel for your face every time you wash it. Dedicate one small towel for your face only and wash it daily, or use disposable paper towels for drying your face, or air dry your face naturally. If you share towels with family, have your own designated face towel and wash it frequently. Your phone deserves attention. Think about how often your phone touches your face during calls and how many surfaces it contacts throughout the day. It's a breeding ground for bacteria. Then you press it against your cheek, transferring all that bacteria to your skin. Clean your phone daily with a disinfecting wipe safe for electronics. Focus on the screen and edges that touch your face. Use speakerphone or earbuds when possible to avoid direct face contact. If you must hold your phone to your face, clean it first. Hair hygiene affects your skin, especially along your hairline and forehead. Hair products, oils, pomades, gels, dry shampoo can migrate onto your skin, clogging pores and causing breakouts. Dirty hair carries oil and bacteria that transfer to your face. Wash your hair regularly based on your hair type and oil production. If you have oily hair, daily washing might be appropriate. Change your pillowcase after washing your hair, as wet hair can leave additional residue. Keep hair products away from your face. Apply them carefully, avoiding hairline and forehead. Pull hair back from your face, especially while sleeping. If you have bangs, wash them frequently or pin them back while your skin heals. If you use dry shampoo, be especially careful. The powder can settle on your face and clog pores. Apply it away from your face and brush your hair thoroughly afterward. Makeup brushes and sponges harbor bacteria if not cleaned regularly. Each time you use a dirty tool, you're applying bacteria along with your makeup. Clean makeup brushes weekly with gentle soap or brush cleaner. Wash sponges after each use or use disposable sponges. Replace brushes and sponges regularly. Every 3 to 6 months for brushes. More frequently for sponges. Between washings, spot clean brushes with brush cleaning spray if used daily. Store brushes and sponges in a clean, dry place where they can air out. Sheets and bedding extend beyond just pillowcases. Your face may contact your sheets, especially if you move during sleep. Wash all bedding weekly in hot water to kill bacteria and remove accumulated oils and dead skin cells. Consider using fragrance-free, gentle detergent if you have sensitive skin. Harsh detergents or fabric softeners can irritate skin and cause breakouts. Hats, scarves, and anything worn on your head or face should be cleaned regularly, especially if worn during exercise or in warm weather when sweat accumulates. These items contact your skin and can trap oil, sweat, and bacteria against it. Exercise equipment that touches your face, helmets, headbands, protective gear, should be cleaned after each use. Wipe down with disinfectant or wash if possible. At the gym, wipe down equipment before use if your face might touch it. Bring your own clean towel rather than using gym towels of unknown cleanliness. Glasses and sunglasses rest on your nose and near your skin. The nose pads and frames accumulate oil and bacteria. Clean them daily with gentle soap and water or lens cleaner. Pay attention to nose pads and areas that touch your skin. Hands must be clean when applying skincare products. Always wash your hands thoroughly before your skincare routine. This prevents introducing bacteria and dirt to your products and face. Avoid dipping fingers repeatedly into product jars, which can contaminate products with bacteria. Use clean spatulas or pumps when possible. If you must use fingers, wash them first each time. Keep your bathroom and skincare area clean. Wipe down counters regularly. Store products in a clean, dry area. Don't leave product caps off where they can collect dust and bacteria. Dental hygiene affects your mouth and chin area. Bacteria from your mouth can cause breakouts around your lips and chin. Brush teeth twice daily and floss regularly. Change your toothbrush every 3 to 4 months. These clean habits work together synergistically. Each one individually helps. Combined, they create a foundation for clearer skin. Make these habits automatic through consistency. Set reminders if needed until these practices become second nature. Within weeks, they'll be ingrained habits requiring no conscious thought. These habits are especially important during active breakouts, but maintain them always for prevention. Clean habits prevent new acne while you treat existing breakouts. Remember that hygiene is just one piece of acne prevention. Proper skincare, stress management, adequate sleep, balanced diet, and sometimes medical treatment are also important. But clean habits are within your control and cost nothing. As we close, embrace clean habits as acts of self-care that support clear skin. Simple hygiene practices, maintained consistently, prevent acne by reducing bacterial transfer and pore-clogging debris. May you develop clean habits effortlessly. May these simple practices support clear skin. May hygiene become automatic and easy. Thank you for this time together. Prevent acne through clean habits consistently.
Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ING/DL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dl, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation, irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why, medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils about acne biology helps reduce stigma. Advocacy for acne as legitimate medical concern, not purely cosmetic, helps ensure insurance coverage and professional attention. Acne affects mental health, self-esteem, and quality of life. It's not just appearance. Supporting those with acne through listening, normalizing their experience, and avoiding acne stigmatizing statements helps. Telling someone, just wash your face, or everyone gets acne, get over it, minimizes their legitimate struggles. Pushing for better acne education in schools helps teenagers understand acne and proper treatment earlier. Supporting dermatology access for all people regardless of income helps ensure everyone can access appropriate care. Advocating for inclusive acne research including diverse skin types ensures treatments developed work for everyone. Guide 80, Acne and the Senses, Smell, Touch, and Sensory Aspects of Skin Care. Beyond visual appearance, acne and skin care involve other senses affecting experience and compliance. Smell of skin care products affects whether people enjoy using them. Pleasant-smelling products increase compliance due to positive association. Some people prefer fragrance-free products to avoid irritation or strong smells. Touch sensations affect compliance. People enjoy using products that feel good on skin. Smooth-absorbing serums feel better than sticky formulations. This affects long-term routine adherence. Texture of products affects experience. Lightweight, smooth textures feel pleasant. Heavy, thick products feel uncomfortable, affecting compliance. Taste concerns arise if people accidentally get acne products in mouth, though should be avoided. Topical products shouldn't taste good, discouraging accidental ingestion. Sensory sensitivities, common in autism, sensory processing disorders, might affect product tolerability. Lightweight, minimally fragrant, smooth-textured products work better for sensory-sensitive individuals. Enjoyable sensory experience with skincare products increases likelihood of long-term compliance. Choosing products you enjoy using, good smell, nice texture, pleasant feel, supports routine adherence. Guide 81, Acne Recovery and Psychological Healing Post-Treatment. After achieving clear skin, psychological healing, moving past acne-related trauma, anxiety, or self-image damage, matters as much as physical healing. Cognitive reframing of acne experience recognizes acne as surmounted challenge rather than permanent identity. I had acne and overcame it differs from I am acne-prone in psychological impact. Rebuilding self-esteem after acne involves recognizing beauty and worth beyond skin appearance. Therapy or self-help work might support this. Managing residual anxiety about future acne recurrence is important. Some anxiety is adaptive, maintaining treatment compliance, but excessive worry isn't. Balance maintaining treatment with accepting that occasional breakouts don't mean failure. celebrating clear skin and the journey to achieve it acknowledges the effort and success. This positive reinforcement supports continued treatment compliance. Relationships and social anxiety that develop during severe acne might persist even after clear skin. Gradual re-engagement in avoided activities supports recovery. Professional mental health support helps process acne-related psychological impact if significant trauma occurred. Guide 82, Acne and Climate Change, How Environmental Factors May Shift Acne Patterns. As climate changes, acne patterns and triggers might shift. Understanding climate-acne relationships helps anticipate these changes. Increasing temperatures in many regions mean more heat-driven acne. Sweat production increases with heat, increasing occlusion-related acne. Climate change's warming trend might increase acne prevalence. Increased humidity in some regions promotes bacterial growth and acne. Drier climates in other regions increase barrier compromise, contributing to acne. Increased air pollution from climate change effects worsens acne through oxidative stress and particle occlusion. Seasonal shifts might change acne seasonality patterns as climate changes. Increased stress from climate-related anxiety might affect acne through stress hormone pathways. Water quality changes from climate change might affect acne through different water exposure. While current climate change effects on acne are not yet clearly documented, these theoretical relationships suggest acne patterns might shift with climate. Being adaptable in acne management as environmental factors change is prudent. Guide 83, Acne in the Digital Age, Social Media, Online Communities, and Misinformation. Social media and online communities have transformed acne experience. Understanding digital age acne realities helps navigate benefits and pitfalls. Social media's focus on flawless appearance increases appearance anxiety and acne-related distress for some. Comparing yourself to filtered, edited images causes unrealistic expectations and self-esteem damage. Curated social media images where people show only their clearest skin days or use heavy filtering distort reality. Recognizing that everyone has imperfect skin days helps maintain perspective. Online acne communities provide support, shared experiences, and practical advice. These communities normalize acne and reduce isolation. Misinformation about acne spreads rapidly online. Evaluating source credibility and distinguishing evidence-based information from marketing or myth is important. Online acne forums sometimes feature unverified treatment claims. Being skeptical of anecdotal stories and seeking professional guidance for unusual claims protects you. Telemedicine dermatology accessed online expands access to professional care, beneficial for those without nearby specialists. Online skin analysis apps using AI might provide useful guidance but shouldn't replace professional assessment. Limiting social media exposure, particularly comparing images, supports mental health during acne treatment. Guide 84, Acne Treatment in Resource-Limited Settings. Many people globally lack access to standard acne treatments. Understanding available low-cost options and treatment adaptations helps those with limited resources. Over-the-counter benzoyl peroxide and salicylic acid are often affordable and available globally, even in resource-limited settings. These should be first-line treatments where available. Local botanical treatments, tea tree oil, neem oil, honey, used traditionally sometimes have evidence supporting their use. These are often affordable and locally available. Oral antibiotics, generic doxycycline, tetracycline, are often inexpensive in resource-limited settings, making oral antibiotic treatment accessible. Isotretinoin might be unavailable in many countries due to cost or regulatory restrictions, limiting treatment for severe acne without this option. Professional dermatology care might be unavailable or prohibitively expensive. Training non-specialist healthcare providers in basic acne treatment helps extend care availability.
Welcome to this tranquil moment of rest and learning. Take a deep, slow breath in, filling yourself with calm. Release it gently, letting any tension flow out of your body. Today we're going to explore one of the most powerful yet often overlooked aspects of skincare: sleep, and how the quality of your rest profoundly shapes the health and appearance of your skin. Sleep is not a luxury. It's not wasted time or something to sacrifice when life gets busy. Sleep is when your body performs its most essential repair and regeneration work, and your skin is no exception. In fact, the connection between sleep quality and skin health is so strong that you can often tell how well someone is sleeping simply by looking at their face. Let's explore this beautiful restorative relationship between sleep and skin. Every night as you drift into sleep, your body enters a different state. Your conscious mind rests, but your body becomes extraordinarily active in ways that don't happen during waking hours. This is when healing happens. This is when cells regenerate. This is when your skin performs its most important maintenance work. Without adequate, quality sleep, no amount of expensive skincare products can fully compensate. Let's understand what happens to your skin during sleep, hour by hour, cycle by cycle. When you first fall asleep and enter the early stages of sleep, your body begins shifting resources. Blood flow increases to your skin, delivering oxygen and nutrients that support cellular function. Your body temperature drops slightly, which is optimal for certain repair processes. Your stress hormone levels, particularly cortisol, begin to decline. This decrease in cortisol is crucial. High cortisol levels are inflammatory and damaging to skin, so nighttime is when your skin gets relief from daily stress. As you move into deeper stages of sleep, growth hormone is released. This hormone is essential for tissue repair and cell regeneration. Growth hormone stimulates collagen production, the protein that keeps your skin firm and smooth. It supports the repair of damage accumulated during the day from UV exposure, pollution, and general wear. Without adequate deep sleep, growth hormone release is impaired, and these crucial repair processes suffer. During the deepest stages of sleep, your skin's cell turnover accelerates. Old damaged cells are shed more rapidly, and new cells are produced. This is why sleep is sometimes called beauty sleep. You literally wake up with fresher, newer skin cells than you went to bed with, assuming you sleep well. Throughout the night, your skin also works on repairing its barrier function. The lipid matrix that forms your skin's protective barrier is replenished. Transepidermal water loss, the rate at which moisture escapes from your skin, is at its lowest during sleep, allowing your skin to retain hydration more effectively. This is why your skin often feels more plump and hydrated in the morning after a good night's sleep. Your body's melatonin levels rise during sleep. Melatonin isn't just a sleep hormone, it's also a powerful antioxidant that protects your skin cells from damage and supports repair processes. This natural antioxidant surge during sleep is one of your skin's primary defense mechanisms against aging and damage. Now let's explore what happens when you don't get adequate or quality sleep. Sleep deprivation has immediate, visible effects on your skin. After just one night of poor sleep, you might notice your skin looks duller and paler. This happens because inadequate sleep reduces blood flow to your skin. Dark circles under your eyes become more prominent as fluid accumulates, and blood vessels become more visible through your thin under-eye skin. Your skin may look more lined and aged after poor sleep because dehydration and lack of plumpness make fine lines more visible. You might notice your complexion is uneven or sallow because cellular turnover was impaired. Your skin may feel rougher or look patchier because barrier repair was incomplete. Chronic sleep deprivation, consistently getting less than 7 hours, or sleeping poorly night after night, creates cumulative damage that accelerates aging and worsens virtually every skin concern. Without adequate growth hormone release, collagen production decreases. Your skin loses elasticity and firmness more quickly. Fine lines deepen into wrinkles. Skin starts to sag earlier than it would with proper sleep. Elevated cortisol from sleep deprivation increases inflammation throughout your body, including your skin. This inflammation can trigger or worsen acne, rosacea, eczema, psoriasis, and other inflammatory conditions. It makes your skin more sensitive and reactive. It impairs healing, so any skin issues take longer to resolve. Poor sleep disrupts your immune system function, making your skin more vulnerable to infections and less able to fight acne-causing bacteria. Breakouts become more frequent and severe. Your skin's ability to protect itself from environmental stressors weakens. Sleep deprivation also affects your skin's moisture balance. Your skin loses more water when you're sleep deprived, leading to dehydration. At the same time, your skin may produce more oil as cortisol levels rise, creating that frustrating combination of dry, dehydrated skin that's also oily. The visible signs of chronic sleep deprivation accumulate over time: premature aging, persistent dark circles, dull complexion, increased breakouts, sensitivity, uneven tone, and skin that simply doesn't respond well to products or treatments. Your skin looks tired because you are tired, and no concealer or serum can fully disguise that. Beyond just duration, sleep quality matters enormously. You can spend 8 hours in bed but still not get truly restorative sleep if your sleep is disrupted, shallow, or fragmented. Deep sleep, also called slow-wave sleep, is when most of the skin-beneficial processes occur. Growth hormone is released primarily during deep sleep. If you're not reaching adequate deep sleep, perhaps because of stress, sleep disorders, alcohol consumption, or poor sleep habits, your skin misses out on crucial repair time even if you're in bed long enough. REM sleep, while different from deep sleep, is also important for overall health and stress management. Poor REM sleep often means poor emotional regulation and increased stress, which indirectly affects your skin through the stress-inflammation pathway. Sleep quality is affected by many factors: stress and anxiety, an uncomfortable sleep environment, irregular sleep schedule, caffeine or alcohol consumption, screen time before bed, underlying sleep disorders like apnea, pain or discomfort, and medications that interfere with sleep architecture. So how do you improve your sleep quality for the sake of your skin and your overall well-being? Let's explore practical, effective strategies. First, prioritize sleep by treating it as the essential health practice it is. not as optional or expendable. Aim for 7 to 9 hours nightly for most adults. Some people need slightly more, some slightly less, but most people need at least 7 hours for optimal health and skin benefits. Calculate what time you need to be asleep, not just in bed, but actually asleep, to get your target hours before you need to wake up and protect that sleep window. Create a sleep-conducive environment. Your bedroom should be dark. Even small amounts of light can disrupt sleep quality. Use blackout curtains or an eye mask if needed. It should be cool. Most people sleep best in temperatures between 60-67 degrees.
Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54: Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible or combining lithium with aggressive acne treatment might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrel, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone. Lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 63: Acne in patients with liver disease and metabolic disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. The insulin resistance driving metabolic syndrome increases androgens and sebum production, worsening acne. Managing metabolic syndrome through weight loss, exercise, and dietary changes often improves acne. PCOS involves insulin resistance and is therefore associated with metabolic syndrome and worse acne. Managing PCOS-related acne involves addressing insulin resistance through diet, exercise, and potentially medications like metformin. Diabetes, particularly poorly controlled diabetes, worsens acne through multiple mechanisms: inflammation, immune dysfunction, altered wound healing. Optimizing diabetes control improves acne. Liver metabolizing medications used for acne, like spironolactone, oral antibiotics, require dose adjustment in liver disease and monitoring for side effects. Patients with liver disease should have liver-specific dosing guidance from their healthcare providers. Hepatotoxic medications, like isotretinoin, which requires liver monitoring even in healthy individuals, should be used cautiously or avoided in patients with liver disease. Baseline liver function testing and monitoring are essential if used. Weight loss, if overweight, provides multiple benefits including acne improvement through metabolic and hormonal mechanisms. Lifestyle interventions addressing metabolic health support both acne management and overall health. Guide 64: Acne in patients with polycystic ovary syndrome, PCOS, comprehensive management. PCOS is a common hormonal disorder strongly associated with acne. Understanding PCOS-specific acne management optimizes outcomes for affected individuals. PCOS involves androgen excess, ovulatory dysfunction, and typically insulin resistance. These factors combine to cause often severe acne, frequently concentrated on the lower face and jawline. Hormonal testing for PCOS includes elevated androgens, elevated LH with normal or low FSH, and often elevated fasting insulin and insulin resistance markers. Pelvic ultrasound might show polycystic appearing ovaries. Acne in PCOS often differs from typical hormonal acne in severity and resistance to standard treatments. Many PCOS patients with acne require systemic hormonal treatment for adequate control. Birth control pills are first-line hormonal treatment for PCOS acne, with formulations containing low androgenic progestins preferred. Typical acne improvement occurs within 3 to 6 months. Spironolactone provides additional androgen reduction when combined with hormonal contraceptives. The combination often provides better acne control than either alone. Metformin, while primarily treating insulin resistance, can modestly improve acne by improving metabolic parameters and potentially reducing androgens. Typical dosing is 1,000 to 2,000 mg daily. Lifestyle interventions are particularly important in PCOS. Weight loss, even if overweight, or weight management if normal weight, improves insulin sensitivity and androgen levels, often improving acne significantly. Exercise, particularly resistance training, improves insulin sensitivity. Dietary modifications emphasizing low glycemic foods support metabolic health. Comprehensive PCOS acne management combines hormonal contraceptives, spironolactone if needed, metformin if insulin resistant, lifestyle optimization, topical acne treatments, and potentially professional treatments. This multifaceted approach addresses both the underlying PCOS pathophysiology and surface acne manifestations. Many women with PCOS achieve significant acne improvement through this comprehensive approach even if acne was previously treatment-resistant. The key is addressing underlying PCOS rather than only treating surface acne. Guide 65, Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin, and